So we want to spend a few minutes going through the process of obtaining a laboratory specimen for COVID-19 testing for EMS personnel. And we thought we'd take a few minutes just to orient folks to the kit that comes and make sure that it's done right, because otherwise the specimen is collected for no very good reason and won't be processed, and it'll be uncool for both the person who acquired the specimen and the patient who had the Q-tip stuffed up his or her nose. So I thought I'd take just a minute. A specimen collection kit looks like this. It's very simple. Looks like this. It's very simple. There are instructions in the back that tell you what to do. And one of the most important part, other than the specimen itself, is this acquisition form or requisition form. And it's very important that it get filled out. And I want to go through the steps really quickly. The top part of the form is all filled out except for the physician's name and signature. Every requisition needs to have an ordering physician. Even if it's pre-populated for you, there needs to be a physician's name, their NPI number, which is an identification number that every physician either knows or knows what it is and knows how to get it, and the physician's signature. There's space on the form for a fax number and an alternate fax number. That's not particularly necessary unless the physician wants to receive the results via fax. And by the way, it's the physician or the ordering clinician, who can be a nurse practitioner or a physician's assistant, who's going to get the results of the test and convey those to the patient or the EMS person. The next section is the patient information part of the form. It's very important that every field in the form, that part of the form gets filled out. It includes the patient's last name and first name, a phone number to reach the patient if that becomes necessary, the address should be the patient's home address, not a work address, date of birth, of course their gender, and their social security number, which is necessary for tracking. The results of this test become part of the patient's permanent medical record and the Chesapeake Regional Information System for our patients. So it becomes accessible as part of the patient's medical record if he or she needs to seek medical care someplace else. And social security number and birth date are an important part of linking the patient's lab result with his or her permanent healthcare record in Maryland. There is a field on here for room number. Room number should be completed with the patient's affiliation with an EMS system. So it could be, for example, Howard County Fire and Rescue. Please don't use abbreviations or initials for these things. If it's the Bel Air Volunteer Fire Department, it should say Bel Air Volunteer Fire Department. Don't make some abbreviation, because that's what's going to be used to track the patient down if there's an aberrancy in the lab test or the result. There's a space for date collected, the time collected, and who collected the specimen. That is, whoever did the Q-tip up the person's nose, that's where that goes. And then there's a space for instructions and comments. It's important that the doctor's contact information be in that space. So for example, I'm about to acquire a specimen on a patient. I made sure my name was there, my email address, which is how the result's going to come, or the portal will be created for the physician to get the result, and a phone number in case there's any need for the laboratory to get in touch with me. All these specimens are being routed through the same laboratory, integrated cellular and molecular diagnostics. They are incredible people who are doing great work to help us make sure that we're providing safety for our EMS personnel throughout the state. They've been a pleasure to work with, but it's important that all this information is on the form so that they can accurately account for what they're doing and get the results back to the people who need the results when they're done. So I'm going to take a moment and just complete this form. And the last part is to indicate why the test was necessary. And there are check boxes at the bottom, and they're self-evident. Probably, I imagine, most people are going to get tested because they had a potential COVID-19 exposure, and you check that box. But there's boxes for symptoms if a patient has any of those, and you can check more than one box, of course. But it's important that one box gets checked. So the two most important parts, maybe there are more, patient's information, that doctor's got to sign the piece of paper and provide contact information, and the reason the test is being done. And if any of those pieces aren't there, the laboratory can't conduct the test. So now we're ready to collect the specimen. The instructions that came from MEMS, you can just discard. I have the kit. I've already completed the requisition. Everything's in order. All the parts are there that need to be there. The form is entirely completed. And you stuff it back into the sleeve that comes on the outside of the pouch. If you need to refer to it, there are instructions in the kit. The important piece of information, in addition to how to obtain the specimen, is at the bottom. It tells you the telephone number to call to have a courier come pick up the specimen once you're done with it. Once the specimen is acquired, it does not need to be refrigerated or any special handling. You just put the test tube back in the envelope, make sure it's sealed tightly, call for the courier to come and get it picked up. That should take care of that. So, our EMS clinician is seated comfortably, which is really important. You want the person to be comfortable. Take the parts out of the bag. The one thing I haven't done yet that we should have done ahead of time is label the test tube with the patient's information. So before I do anything else, I'm going to do that.
You need a pen.
Need a pen. I'm not contaminated yet. I'm still good.
There you go.
There have to be 2 identifiers on the test tube. So the patient's name and the patient's date of birth. And it helps to put the date on it. So that way, once the specimen's collected, I'm not messing with a potentially contaminated thing. So I just put the test tube there. It's all ready for me. This is a really simple assignment procedure. There are 2 swabs in the kit. You just need one of them. They're both the same. You ask the person if they're ready. Are you ready?
Ready.
Okay. So he's comfortable. If he was in a chair with something behind his head, that would be okay too, sometimes preferable. The reason I'm on all those PPE is because I stand a chance of making the person sneeze or cough or gag. It doesn't generally happen, but you just want to be cautious just in case. I just sort of support the forehead like that. You can go up either side. Sometimes it helps the abs. Go straight back, not up. Do you feel like a little resistance? Spin the Q-tip around a couple times. Give it time to percolate. And that is all there is to it. Open up the tube. Stuff the Q-tip in the tube. The Q-tip is scored. I keep saying Q-tip, cotton swab. It's scored, so you should be able to just break it off. This one's being a little cantankerous. There we go. Put the lid on the tube, secure it tightly. Notice the tube has some transport media fluid in the bottom. It's important that the transport media covers the top of the tube. It would be great if you had somebody else hand you the bag, put the tube in the bag, seal it all up. And is ready for you to call the lab to have the specimen picked up. Are you okay?
I'm okay.
It wasn't that bad, was it?
Wasn't that bad.
Brought tears to your eyes.
A little bit.
And that's it. So that concludes the procedure. The specimen is in the bag. The test tube is securely capped, so nothing will leak out. The top of the bag is sealed. The requisition goes in the back pocket. It is completely filled out. The doctor's contact information is there, as well as all the patient information and the indication of what the patient's affiliation is, what fire department they're from, what rescue squad, etc., ambulance service, all that. The next step is to call the laboratory, the Integrated Cellular and Molecular Diagnostics Lab. The telephone number is on the instructions that came with the specimen collection packet. Call the lab, tell them where you are. A courier will be dispatched to come pick up the specimen. Could be really quick, within an hour or so. Could be tomorrow if you're not calling till the end of the day. In the meantime, just keep the specimen in a safe place. There is nothing that has to be done special, such as refrigeration. If you need more information, and we encourage you to do this, go to the LMS or the Learning Management System and watch the New England Journal of Medicine video on how to collect a nasopharyngeal swab. There's continuing education credit available for that. Good luck, stay safe, and be healthy.